So welcome everyone for joining us this morning. Today's session is all about a very real challenge many of you facing probably day to day, how to run community funding and grant funding schemes efficiently, transparently and at scale without being drowned in spreadsheets, emails or manual tracking or in kind of antiquated systems that may be online and may be digital but just aren't quite working or certainly not following a scheme or a grant process all the way through to reporting, let's say, and measuring impact. We're going to look at how developing healthy communities manages funding across 5 health and social care trust areas. So we'll find out a bit more about that from Sarah Jane and Pauline shortly. And just basically how a flexible grant management system like Submit supports that work end to end. So I'll be asking some questions, but this is certainly not a sales pitch from my side. This will just be looking at how developing healthy communities are using Submit, what has been the learning curves, because I've been using it for a little while now, coming from a different system, and how, I suppose, what learnings they've had, what has worked, what perhaps hasn't worked, but certainly looking towards the future, how they can use the system to continue to scale and grow as an organization. So we'll hear directly from the people doing the work. I won't promise me, I won't be doing all the talking. So we've got Sarah Jane Goldring and Pauline Kelly from the DHC and one of their grant recipients, which is great because it's always good to have the other side of the process. We have Helen Logan from the Causeway Giants wheelchair basketball team. So that's great. So we'll keep it practical, honest and focused on what's actually changed in their day to day. We'll walk through, as I said, the full life cycle. We'll leave questions perhaps to the end, if that's okay. And we'll certainly follow up afterwards. So without further ado, I suppose, Sarah, as I'm looking at you, I'll start with you. And if you want to give us an idea and the background of where you were coming from and how you came across Submit and what you were hoping for at the initial stages.
Okay, thank you very much, Dee. I suppose, listen, just to be really honest about it, I came into post last year, 2025, on the 14th of January, and the first thing that greeted me was that the system that they were using for short-term funding was not working for them as a team, and it wasn't working for the end user or for the beneficiaries. And obviously I was kind of thinking, right, well, we'll find something new. And then at the same time, the Public Health Agency, who we manage the fund on behalf, more or less said, we're going to be opening this earlier this year. Normally it opened July, August time, and they told me it was going to open after Easter last year. So I was thinking, right, I'm going to have to find something really, really quick, and actually get my head around it, because as far as I was concerned, being a computer programmer was not part of my job description. And I think at that point I was more or less kind of saying, if it is, then I'm looking for another job, because it's definitely not something I feel comfortable with. So just completely out of the blue, another organisation that I would support outside of work in a voluntary capacity, I was completing an application for them, for a local council, and I came across Submit. And I was thinking, who are this crowd and what do they do? And luckily for me, I actually used to work at that previous local authority, and I was able to lift the phone and speak to a couple of the staff in there, and they were saying, look, they're really, really easy to deal with. Anything you need, just lift the phone or send them an email. It's really straightforward. You'd be able to do it, Sarah Jane. And I was thinking, right, well, we'll have a look and we'll see. And we were just actually checking through emails last week, Pauline and myself. And I think I had emailed you, Dee, on the 10th of February last year. And it was just in the wake of Stormy Owen as well.
Yes.
I just remember thinking, right, we have to turn this around and be up and running by the Monday after Easter, which was, I think it was like in and around the 10th or the 11th of April last year. So that was an 8-week turnaround. And I remember kind of going to the team. I was really new. They didn't know me. They had no idea about my work ethic or about maybe how practical or realistic I was. And I was saying to them, we're going to do this, and we're going to use this organization called Submit, and they're going to be it's going to be much more pragmatic for us and efficient. And they looked at me and they were like, there is no way this is going to happen. And I remember them thinking, the amount of pressure they were going to be under. But actually, in actual fact, I was able to build the application last year by myself, which I'm very proud of, I should add.
Okay.
And we turned it around. We got it up and running, and Pauline will go into more detail about that, and she can probably be very honest about that whole feeling in terms
Yeah.
of the pressure, the expectations,
Mm.
but actually, most importantly, yeah, it looked good for us, and we thought it was a win for us, but actually,
Yeah.
were the beneficiaries and were the applicants going to feel the same way because the previous system hadn't given us that
Mhm.
reassurance or that clarity or that ease. So that is how we have come to be where we're at now.
Yeah, thank you so much. And I remember those first calls and you me kind of going, yeah, you can do that. Yeah, and being like, yeah, absolutely. And you're like, really? So the proof is in the pudding, I suppose. So Pauline, do you want to talk a little bit on that then, that process and getting set up and the differences, I suppose, what jumped out at you at the beginning?
Well, as Sarah Jane said there, she actually built the application process. And so to start with, we would advertise and then the application process, the grant supply. We would do letters of offer out and that then.
Yeah.
We would normally have a lot of queries that would have to be sent out. In relation to the feedback that we got, because the previous year we had spent a lot of time on the phone with the applicants, talking them
Mm.
through exactly what needed to be done. There was an issue with the saving in it. There was a couple of different issues with the finance part of it. So we had spent a lot of time. It was very stressful on the phone with applicants before it even had closed, before we'd even started assessing all those applications. So the build up that we would do normally, where we would have our work to be doing, was like constantly on the phone with people talking them through.
Yeah.
So this year, even though as we're going along now, we're realizing the application that Sarah Jane built last year, we've now added to because there
Mhm.
was things that we realized should have been in there and need to be in there.
Yeah.
So this year going out, I would say it's going to be even more user friendly, and more streamlined for us with the information that we need in the background.
Yeah, excellent. And then, Helen, if I can bring you in terms of, and I'm not sure if you'd applied previously and gone through the old system, but what did you find applying as an applicant using the Submit platform? Hey there, Helen. Or are we on mute now? One second now. I'll unmute you. No, you might need to unmute on your side there, Helen. Hello, hello. Are you
Sorry.
unmuted? Hey, we have you now. Hi, Helen.
I'm just trying to use this phone and it's not great. I actually didn't realise in the background that this was all new. So for me, you've done it really well because it was so easy, my end. And it was very it was short, but all your information was in there. And we found it very clear. And the other thing was the communication back and forwards was brilliant. We didn't have an awful lot of back and forward communication, but it was they got back to us straight away. So we found it very, very easy to complete. And I'm very surprised how new it is because it didn't feel like you were on a learning curve our end. It was really, really
Excellent.
smooth. So brilliant this end and very clear for us.
Very good. So in terms of the application process, was there, and forgive me, I'm not sure myself, if there was multiple stages to it, was there different rounds that you had to get through? And I suppose from your side, Helen, was that the case, first of all? And secondly, to Pauline, perhaps, how did you manage that communication using the Submit platform?
Well, there was stages that we had to do, but everything was very clear. Your emails came through and everything was there, what you had to do next. Plus, I have to say, as a community group who are voluntary, the reminders were really good. There was reminders came at stages as well, which made it easy because we were able to keep on top of things. And we liked how it was staged. It made it slightly easier our
Mm.
end as voluntary people trying to do this in our spare time.
Yeah, yeah. So, Pauline, how did you, from your end, find the communication within the Submit platform? I suppose using it more like a communications hub, really, not just for reviewing the applications.
Yeah, the communication was really easy. Yeah, emails went out, as Helen said. We were able to set reminder emails in relation to getting invoices in or their letter of offers, or even when the application process was in draft, we were able to send an email to everybody who had applied to say it will be closing. Can you ensure that you've completed your application? So in that way, it was great because they just went out automatically. So
Brilliant. So in terms of the automation, the notifications, and I
yeah.
suppose, what kind of impact did that have on ye internally as an admin team, in terms of just simplifying the process and comparing it to what you used to have to manage, like you said earlier, being on the phone constantly, guiding people through the form and so on?
Yeah, it was just more time efficient and allowed
Yeah.
us then to, as I say, we've streamlined the process again this year, which is
Mm,
going to make it more time efficient for us as well. And I
yeah.
think the last system that we had was just not fit for purpose, where we know with this, I suppose in the other end, it's the user that we want it to be that straightforward.
Yeah.
So it really has, it's revolutionized, the grant
Fantastic.
process for us. So yeah, it's
Yeah.
been really good.
And what about in terms of the reviewers? I know at Submit we call them the external reviewers, but the people that are reviewing and assessing the applications as they come in. What's changed there about how the applications are, I suppose, assessed or documented?
Well, they have access, so we're not sending them
Yeah.
anything where before previously. Though we still do set up an assessment panel, but they have the information before that goes out and it's been
Mm,
all reviewed and all. So it really has shortened that process as well.
yeah. Okay, brilliant. Sarah Jane, if I can come back to you then. So if you can take me through very briefly, you advertise the fund, you share the link, you review, I suppose you accept the applications in, you review. What happens after somebody is awarded, and how, if you can talk a little bit on the kind of data and reporting and measuring impact again
Yeah.
after the fact, or any follow-up reporting with the recipients like Helen.
Yeah, so look, I suppose, look, this is a very popular fund. So maybe just to give a bit of background as to what this
Yeah, thank
fund
you.
is. So this is money that the Public Health Agency give us to administer on their behalf. So essentially it is derived out of the Department of Health in Northern Ireland, and it comes under the mental health strategy. So the money that we are investing in communities at community level is part of the Protect Life 2 action plan, whereby we're supporting grassroots community organisations to, I suppose, familiarise themselves and to empower themselves around protecting life, supporting positive emotional well-being, and
Mm,
essentially with a view to preventing suicide. Okay, so that's where
yeah,
this money really, but that's the background and the context to that. And I suppose, like, obviously, we have 5 trust areas. We have Belfast, Northern, Western, Southern, Southeastern, all with varying populations and obviously different levels of deprivation and mental health issues. And the Western area, which is actually sort of north of Derry City, right down to below Enniskillen, is
mm,
probably the largest geographical area, but also probably one of the more rural areas, but also it is the area that has the most demand for this particular program. Historically,
yeah.
that's where the grant started off. Okay. So it has been well embedded in this kind of
Mm,
landscape for a long time now. So essentially, we are looking at supporting people who have a very clear mental health or emotional well-being aim and objective to their proposal. And
yeah.
we have 2 awards. The first award is up to £1,000, which is very straightforward, and because you don't need to be a constituted group or organisation or have charity status. So it means that it is straightforward, and it is easier, but it helps build capacity, it helps build awareness, and helps empower communities.
Yeah.
The second one is up to £5,000, and there's a little bit more of an effort required to complete that application, and that is
Yeah.
evidenced in the application form as well, which Pauline might talk about a wee bit more later
Mm,
on. So again, there are 2 different levels. So we are looking at why organisations want this money, what will
yeah.
they need it for, if there is a model, I suppose, of best practice that they can cite in terms of how they know this works well, and what steps will they take to evaluate and monitor the success and the outcomes of their programs within the community? And we're not asking for a thesis. We will actually suggest a range of different evaluation tools they can use. And again, we use kind of the step 5 model to try, I suppose, and break it down to make it easier for people. And obviously they can reflect that in the step 5 evaluation model. But essentially what we try to do, and what this system does do for us very well, we can categorize which trust area it's in. We can determine why organizations, so for example, organizations might say that there's a need because they are working with single people, they are working with men-only groups, they are working with people who've been bereaved by suicide, they're working with people who are rurally disconnected, or are rural and have no access to services. So those types of categories. And I suppose, Helen's organization as well, for example, it could be access to services where their team maybe hasn't had the ability to avail of funding before because they're very, very niche, but in actual fact, they are exactly the sort of group that we are looking to support, because we understand all of the additional well-being needs that go with I suppose, the type of individual who is in that basketball team. So I suppose we're able to break down all those subsections and look and analyze those types of things, but we're also then able to cross-reference that against areas of high deprivation, what we refer to, or as the NISR stats refer to, as super output areas. So if there's higher deprivation in an area, health inequalities are going to be lower. There's a higher propensity or vulnerability regarding emotional well-being and mental health. So we're able to report all that information back, and we're able to break that down using Submit. I suppose as well, the Public Health Agency are great to support us to be distributing this money, but equally they will come at us hard as well in terms of, right, there's an assembly question in, we need the answer by 12 noon tomorrow, or such and such an MLA or whoever has that requested this information. So Submit really is kind of our database for all of that information. We can put in even there, it was a couple of weeks ago, just before Easter, Pauline, the health minister, was going to visit somewhere in County Down, and it was like, right, who in this area has received this money? And it's just like, right, okay. So, there's a very quick turnaround, but we're able to do that. And Submit gives us the ability, and I think as well, the ease, we're easier in our own mind that, look, we'll be able to pull it out. We also understand as well that it is more powerful than we're aware of, and that we are still very much in a learning process, as Helen said. Even though it was new, which is great to know that it looked very seamless for everybody. But as well, look, we still have a lot to learn, and I think that's still going to be part of our journey.
Yeah, absolutely. And sometimes with us, certainly with new clients, and it's not until you've kind of run a scheme that you kind of realize after the fact, oh, I wish we knew this, I wish we knew that, if you do have those ad hoc reports suddenly kind of thrown at you. With any new client, it's very important for us to understand, how are you measuring impact? What is the data points that you need to be able to collect, and will really make a difference, especially if you're getting funding from elsewhere. You need to be able to present the facts so you can ensure you get continued funding, because that's an issue for a lot of people at the minute, is making sure you've got funding for next year so you can still be doing the programs that you're doing now. And in terms of the flexibility of the platform, so Pauline, I might bring you in here again. I know Sarah Jane kind of created the first form, but the tweaks and the edits you've made, how simple have you found the platform to make those kind of changes based on what you now know will be requirements for reporting afterwards?
No, it has been very, very, very easy. The last system that we had, we actually had to get an advisor in to look at it, and they were saying that it was just over-engineered for the purposes that we needed. Where Submit, we couldn't go on and change the information on that system. Something would have happened in the background. You needed to be able to code. So Submit is just so much easier. We can go on and change stuff. As Sarah Jane said, I think it has really built our confidence, because before with the old system, we weren't confident because there were so many hiccups and mistakes for their users. So it definitely wasn't user friendly. So it's definitely built confidence for us on that system. And as well as that, it is GDPR compliant, which is
Yeah.
really good too and very important to
Yeah.
us. Yeah, it's just I suppose the difference is the feedback that we've got from the organisations has been amazing this time. You know, and that in the
That's
running
it.
of the grants is what is important to us. And we're building capacity as well through the system
Mhm.
being so easy to use.
Yeah, you can definitely scale with it. It's quite, look, it's a very robust bit of software, right? To do
Yeah.
everything you need to do, but it has that flexibility that it can pivot with you and scale with you and kind of meet you at your own pace. You know, if it's something that's okay, up and running, okay, we got you, or it's something you can build out and take time, maybe end of year reporting and things like that across schemes. So I suppose, if you were advising a council or another health body or community group starting to modernize their grant processes, somebody who is stuck with maybe an over-engineered system or drowning in spreadsheets and Excels and, SharePoints floating around the place, and what would be your first step? What would be the first thing you'd recommend to try and get to grips with everything?
Just to start at the beginning, I mean, we had Robert Dunleavy,
Yes. Yeah.
and he was very accessible in relation to it. And I think he realised how nervous we were starting
Yeah.
on this new system. So he helped us build confidence on it. It really is literally going in and playing about with it.
Mm.
As Sarah Jane says, she managed to build the application process within the 8 weeks,
Yeah.
and it suited our needs. And now we've gone in. So we've looked at where we were. We've taken learning from last year. So we have changed questions about where some documentation was missing last year, where this year we've put it more streamlined as upload
Mm.
one document at a time. And if they don't upload it, you can't move on. There is a couple of ones there where we have like auto reject, where if you're
Yeah.
not a community and voluntary organisation, it will auto reject. So you're not even seeing those applications. There's an email going straight out. They say it has been declined and stuff. So I mean, it is literally, it's not something to be afraid of when you're on Submit, which I think is the lesson that we've learned, because we were very, very nervous with the new system after the last system that we had.
Yeah, no, I know you had, I suppose, your fingers burnt in the past, and Robert is great. Again, he's part of the customer
Yeah,
success team and support.
definitely. He'd done a couple of
Yeah,
onboarding sessions with us, so we sort of
yeah,
knew what we were doing before we started off. And it just, as I say, once we realised how easy it was, because we obviously tested it ourselves as well too.
yeah. Oh, yeah.
So yeah.
Brilliant. So, Sarah Jane, if I could ask you in kind of one sentence to round it up, because I'll see if there's any questions from the attendees there as well. But what change are you most proud about in how you manage the community grants?
I would have to say, look, I suppose, look, we're delighted with Submit and we're delighted for the beneficiaries like Helen. But for me, the proudest thing for me is that the team are back on an even keel. That ability to have completely reassured a team in one full funding cycle that this works, that it's reducing their workload, it's reducing levels of stress. For me, I could not be happier in the position that I'm in, and I would say that wholeheartedly. Yes, it's great that we have a great funding portal, but at the same time as well, the fact the team are all working together in the one direction. And we like last summer, the team were able to enjoy their summer. They were able to go off on their holidays and not have to worry about coming back to some kind of level of chaos that they'd experienced the previous year. So we are delivering grants that are supporting well-being in the community, and it's really important that there's well-being maintained in my own team. So that
Yeah,
for me, it was a leap of faith for us, but it was 100% the right leap to make, and
yeah.
we're delighted with ourselves. So
Oh,
thank you,
thank you.
and a massive thanks to Robert and Levy, because I suppose, look, the wealth of information on offer, you can, if you're too proud to ask for help, you can find loads of different links in the Submit portal. And equally, like Robert was able to send us videos as well to help us understand why something has been done. And then we had access to him one-to-one as well. So look, it has, as I think Pauline said, it has revolutionized our experience.
Excellent. And thank you for trusting us, because I know, as you say, it was a leap of faith, absolutely, at the beginning. Pauline, would you like to add anything there?
Just that it has been a very positive experience for us as well as the organisations. So that's been great.
Oh, thank you. Brilliant. And Helen, I suppose,
Yeah.
as a worthy recipient, do you want to tell us a little bit about your organisation and what you've been able to do with the funding from developing healthy communities.
Well, I have to say, well done, because I wouldn't be scared to reapply for this grant. And as somebody out in the community, there's grants that we have took a lot of time applying for, spent our spare time on, and not got. And it's not even the fact of getting or not getting it. I won't be scared to reapply for this grant because it was so easy. It was so streamlined, and it was asking me the stuff that was important. And for our group, it's really important that we don't shy away from grants, because I'm working with a group of people who are very limited in where they can go. And this grant meant that we were able to bring different people into our group on site and we provided sports, massage therapy. We went to a specific gym that provides for people in wheelchairs, and all of that was making them build and get to know each other. And if I did apply for these grants, I'm not doing that wee community justice, to be honest, because there's so much mental health connected with being a wheelchair user, having long-term conditions. Their world is so different. So to be able to be confident enough to apply for grants and get that funding and make a difference in their lives, that money made such a difference this year. You have no idea. It's just their well-being is so much better just because I wasn't scared to apply for a grant. And I can't believe that you're only on this platform, because to me it was one of the most streamlined but best engaged. Like, I felt like I knew where I was with the grant, and I was always getting feedback. It was well done, because I just can't believe you're only doing it. It was. I honestly would tell anybody to apply for this, because it was so easy, but so much connected with you. There was never a point where I felt like I didn't know where I was. So thank you, because it has changed lives, and we shouldn't be scared to. We hadn't been linking into grants, to be honest, and the difference this has made to a whole community who's a little bit different has been brilliant. So well done.
Thank you, Helen.
Yeah, we're so chuffed that we made a difference, so thank you.
Yeah, excellent. That's a lovely message to kind of end on. And credit to Sarah Jane and Pauline and their whole team for, taking the new bit of software by the horns and kind of running with it. And look, it's paying off in spades. And again, as you continue to scale and grow, think of all the other groups like Helen's that you're going to be helping across the whole region. So I wanted to see if there's any questions from attendees. If you wanted to put anything in chat, I've got kind of welcome messages from Sue and Catherine at the beginning. I'm hoping you can all hear us, and if you had any comments or any questions, we kind of round it up. So that's fairly sweet, because normally half an hour, I think, is a good chat, and then leaving room for Q&A. But hello, allowed to talk? Hi. There we go. Hi, Jane.
Hi, I just wanted to say thank you. It was really useful. I really enjoyed the way you presented it, and you have hit all the issues by making that session very user-led. Thank you very much.
Oh, thank you, Jane. Yeah, that was the whole point, because I could talk for hours on it and probably bore you all to death, but it's really about you guys. It's about the likes of Sarah Jane and Pauline and the differences that this bit of software can make to Helen, by just giving you the ability to do your work and not to be stressed and, getting lost in spreadsheets and finding and losing things in SharePoint.
Yeah.
Jane, do you want to share anything about your frustrations at the minute, or any issues you're having?
No,
or what struck you most?
I think you've honestly, it's the automation. You need a person behind the system. That's obvious as well. And but there's a lot of moving bits of paper around. I mean, not literally paper, and I think that automation of keeping everybody up to date with what's required of them is really, really helpful.
Yeah, thank you so much, Jane. And yeah, I was going to say, Catherine as well, one of our attendees, has said, thank you, ladies. I was aware of how easy Submit can make funding applications, but it was great to hear it from an end user as well as the administrative team. So I think that's, look, software is only as good as the people who are using it. And I think something we definitely pride ourselves, and I'm delighted you gave Robert a shout out, but I'll have to shout out for Sarah and Vera and Eric there as well. They really do hold the hands of the clients to get you set up and make it usable for you and your recipients. Every client uses the software slightly differently based on their workflows and so on, and the different schemes, but it's about you guys. It's us supporting you, and the software is just one of the ways that we do that. So thank you, Jane. Thank you for that comment. I really appreciate it. Ladies, I just want to thank you once again for giving me your time and just for sharing your story. It's been wonderful having you. Thank you to all my attendees. And again, for anybody that is watching or recording, thank you for watching. I'll speak to you again very soon, and I'll tell Robert that you'll be on the phone again very
Thank
soon
you.
to set up the new scheme. Thank you, everybody, for joining.
Thank
Have a
you.
great day. Bye.
Thank
Bye.
you.
Thanks again.
Bye.
Okay, so